In the kingdom of endocrinia, the pancreatic isles and the body's tissues worked together to keep sugar in balance. But as the years passed, new troubles arose: type 2 diabetes mellitus, T2DM, a complex and sneaky foe. The two main problems in type 2 diabetes. 1. The tired tissues, insulin resistance. The kingdom's muscles and fat stopped listening to the insulin messenger, so sugar piled up in the bloodstream. The liver, too, ignored insulin's orders and kept pouring out more sugar. This resistance was mostly caused by the kingdom's changing ways: too much food, too little movement, growing waistlines, and the passage of time. Some families were more at risk due to their genes. 2. The weary beta cell guild, impaired insulin secretion. The beta cell guild in the pancreatic isles couldn't keep up with the demand, either from birth, genetic programming, or after years of overwork. As sugar levels rose, the guild became even more exhausted. A vicious cycle called glucotoxicity, where high sugar made the guild weaker, and the kingdom's sugar storm grew worse. The role of diet, obesity, and inflammation. The kingdom's growing love for feasts and rest led to an obesity epidemic, even among children and teens. This made T2DM more common than ever before. The risky roads to type 2 diabetes. The wise doctors watched for travelers on these risky roads. Family history of diabetes. Overweight, BMI greater than 25. Physical inactivity. History of impaired fasting glucose or glucose tolerance. History of gestational diabetes or big babies. Signs of insulin resistance: high blood pressure, low HDL, high triglycerides, PCOS, or dark skin patches, acanthosis nigricans. The special cases: Modi and Lada. Maturity onset diabetes of the young, Modi. In some young people, usually under 25, a single gene mutation caused the beta cell guild to falter. Modi was passed down in families, autosomal dominant, with no immune attack. The most common gene culprits were HNF1A, GCK, and HNF4A. Some with the gene never developed diabetes, and some with Modi symptoms had no known gene mutation. Modi looked a bit like type 2 diabetes but happened in the young and didn't require insulin. Latent autoimmune diabetes in adults, LADA. LADA was a slow, sneaky version of type 1 diabetes in adults. Patients had at least one islet autoantibody and kept making insulin for a while, but eventually needed insulin as the beta cell guild faded. LADA shared features of both type 1 and type 2 diabetes. Doctors used antibody tests to spot LADA, especially when the diagnosis was unclear, or when patients didn't respond to usual medicines, weren't overweight, or had a family history of autoimmune disease. With careful observation and testing, the doctors of endocrinia could spot the many faces of diabetes, break the vicious cycle, and help restore balance to the kingdom's sugar.